Good morning, my fellow Americans. I've been talking to you the last couple days from Cabo San Lucas, and I'm in H+ hospital today trying to look at the hospital facilities around Mexico to see how they compare with hospitals in the United States. From outward appearances, the hospitals down here look great. The hospital I'm in today is a hospital that was built only 2 years ago. It has the most modern technology. The people are great. I've met a lot of friendly people, a lot of people who seem to care a lot about their patients. One of the things that's interesting when you come to some of these other countries and look at their healthcare, almost all of them say patient first. I was in Israel only a couple months ago and there were signs all over the hospital that said patient first. I don't know what kind of signs we put up in an American hospital, but I'm sure in all the doctors and nurses lounges, the signs would all say money first. Let's see, how many tests can we order today? How many x-rays can we get done? And how can we make that bill bigger? We have great doctors and great nurses in the United States. I'm sure they compare to doctors and nurses I have met all over the world. And I know that they started in medicine with the idea that they wanted to help people. They wanted to make the world a better place. That always works great, but today in the United States, when our citizens, our students are getting out of school and trying to pay off bills of maybe a few $100,000, they can't go start a practice by themselves. They can't afford the malpractice insurance to start out. So they work for a giant corporation. And in many areas now, as you well know, the giant corporations are buying up medical practices left and right. Why do they do this? Because it's such a good business. Our pharmaceutical industry in the United States makes more right now than the oil and gas industries do. And being we've got so much fake news today, I don't know if what I'm going to tell you is exactly right, so I'm going to tell you that ahead of time. But I believe I read some time ago that for every $100,000 a drug company spends on television, they get an average of 18 new people using their medications. Now that's a pretty good return, wouldn't you think? Spend $100,000, get a 20% return in number of patients, almost. That's great. Please, when you start looking at your healthcare, I'm down here because I'm looking at alternative healthcare, and I'm looking at healthcare in countries that us many uneducated Americans have formerly thought were third world countries. Right now, our United States of America has become more like a third world country when it comes to health care. Consider your options. Do not hesitate to come down to Mexico, Costa Rica, UK, Bangkok, Thailand, many places in the world that you're going to receive superior care to the United States. Please keep this in mind and do it for a fraction of the price, and have a great vacation while you're here. Enjoy the sun, the surf, the sand, and the beautiful people. God bless all of you. Have a blessed day.